According to data from the University Hospital of the West Indies, in 2019, the hospital admitted some 393 cases on the psychiatric ward, but in 2023, that figure jumped to almost 500. Fast forward to the present, and the numbers are startling. Prior to the COVID-19 pandemic, the hospital saw 30 to 40 patients weekly for mental-related illnesses. That number has since increased to at least 50 weekly. Some of these patients are being accommodated in the accident and emergency department as they wait for a space to be admitted on the psychiatric ward. Medical Chief of Staff Dr. Carl Bruce says the growing demand highlights ongoing challenges in mental health care at the facility.
What we had to do was to create a section in the emergency room. Even though we know it's unofficial and it's temporary, that area is always full. And this is despite transferring patients outside to the mental hospital. And at this time, Ward 21, our mental facility that takes really great care of those patients, have a waiting list only. So we now see that the challenge with mental health is not just a blip, it's persistent, and we're going to have to deal with it also.
Most cases involve patients in the acute phase who require urgent, immediate care. Dr. Bruce says these patients are a danger to themselves.
I think the increase in the number of mental health patients that we're seeing is multifactorial. Yes, there were the challenges of patients not accessing care in COVID, but I think all of us can agree that the pandemic brought with us a lot of stress. And a lot of people have not been able to manage their mental space, have not been able to manage their personal space well. And so it's multifaceted.
Dr. Bruce says the approach must go beyond emergency room treatment. He says simply treating patients by giving them medications is not enough.
You're going to need to have long-term follow-up, and some patients are going to need to be in a facility. Others, we can use our community program to try and help them in the community, which we prefer at times. But definitely, when a patient has acute psychosis, the families, the healthcare workers definitely have to turn to the hospitals to stabilize them, to diagnose them, and then to find a treatment regime that will help them overcome the acute part of their mental health disorder, then take away and work with the doctors on the stresses that are causing them to tip over. And then we can continue to manage them in the community.